Hi Topes, thank you so much for joining us today.
Thank you for having me.
Should we just start with you telling us a little bit about who you are and what you do?
Okay, well, my name's Topes, and I'm a psychotherapist, and my training's in child and adolescent psychotherapy and group analysis. And mostly I work with adolescents, young adults. For some reason, it's sort of mainly young men, and yeah.
And what was it specifically that drew you into the work that you do?
I mean, I don't think I ever had sort of any idea that I was the type of person who could really help people. I think when I was younger, I was actually quite selfish. So I think a lot of it was just a sort of path that evolved. So I'd originally planned to work in financial PR, mainly because I thought finance sounded kind of important, but I couldn't do maths. And then, so I was doing a little bit of tutoring, and then it ended up being good with the kids who were sort of struggling in some sort of way, like behaviourally, emotionally, and moved more into coaching, and then had some success in that, and that kind of took off, and that was really fun, you know, just traveling all over the world and working with families in a really immersive way. But then sort of towards the end of my 20s, it got to a point where I realized that it wasn't sustainable. And so I thought, okay, well, I guess the next step is to do a psychotherapy training. So then came back to the UK, went to school, and here I am.
And so is there any particular, when you describe so obviously you work with a lot of teenage boys and sort of, I suppose, young adult men. In terms of the presentations that you work with, is there anything in particular, like do you work with young people who struggle with addiction, for example?
Yeah. I'd say that's one of the biggest presentations that I'm working with. So I'd say addiction or substance misuse is probably what I've developed some sort of niche in. But then also, more generalized things like anxiety, depression, but they're often comorbid with the substance misuse. And so I think there's sort of the whole range of presentations, but substance misuse does seem to be a big player in my practice.
And why do you think that is? Do you think, what was it that kind of brought you to working with addiction mainly, or what was the magnet there, do you think?
I think it was less of a magnet and more in the type of work that I was originally doing, which was coaching. I think back in those days, the emphasis on what I was doing, there was the concept of like the sober companion, whereas that didn't really exist for any other presentation in the same way. And so inadvertently, I ended up being some sort of sober companion. And I think, I was working a lot with kids who were acting out, and I'd sort of had a rapport with the people who acted out more than sort of acted in, the quieter kids. At that stage, I guess because I was probably quite loud as well. And so, so it just evolved from there. Substance misuse was the presenting difficulty that often would require my type of work. And then I ended up, because I had that lived experience of, when you're trying to, keep someone from using or support someone not to use, because obviously you can't keep them, then I really understood it because I was living alongside that person sort of 24 hours a day, 7 days a week, understanding in real time what was going on, the temptations and the triggers. So even though a lot of the work that psychotherapists do can be theoretical because it's not necessarily in their lived experience, I'd really lived somebody's journey of struggles with substance misuse alongside them. So when I became more of a therapist, it was a natural fit for me to specialise in that type of presentation.
Do you think, I think because a lot of people who perhaps, work in the industry or who perhaps are in recovery themselves might have heard of coaching, but how would you describe the type of coaching work that you did do initially? You talk about, living in with someone. Can you describe sort of like the types of work that you would do when you were living with someone, and how is that beneficial for someone who's struggling with addiction, like a teenager?
Sure. So I think the type of work that I would do, and again, because it was completely organic the way that I got into the industry, so I didn't really know what my sort of job spec actually was. I just did what I felt was right as I went along. And so it ended up being a lot of project-based work, because I thought, well, I've got to find something to do. If they're having to sacrifice something that they were doing, which was drugs, then that's got to be replaced with something else that sort of helps them to feel you know, validated and like their life has some sort of meaning and purpose. And so yeah, we did. I guess I didn't really have much of an off button as well, but what was realistic. So we did these huge projects like setting up galleries or, you know, setting up lots of businesses, or, okay, you know, you want to, you know, you haven't really been to school, but you want to go to this top university. All right, we can figure it out. So I didn't necessarily know the theory about why it was working, but what I did know was that it was helping, and it felt you know, intuitively like the right thing to do.
Yeah.
And then I guess sort of studying as a therapist and learning about, for example, existential therapies and the importance of young people establishing meaning and purpose in their lives and some sort of identity and feeling like they have something to offer the world. It was really important, but I wouldn't have been able to explain it in those terms at the time.
Yeah, and I think, you know, it's something we see so much at Lions Campus is the importance of, I suppose, these projects that you talk about as well, and like how important it is for sort of self-esteem building and really getting stuck in and doing the work in many different ways. I think I love that, and, you know, and in the program that we offer, and I think, you know, it's amazing to hear in the work that you do as well. I remember when I think you worked at Lions Campus doing some groups and setting up a project with them, which was really successful and such an important part of all of those clients' journeys. So in terms of the sort of addictions that you see nowadays, because, you know, I suppose addiction is still present, but perhaps what people are becoming addicted to changes. Have you seen any changes or trends recently with young people?
I mean, I think in terms of what people are addicted to, there's been a huge sort of rise over the last few years in ketamine addiction. And also prescription medications, so benzos, things like that. And if I were to speculate, I imagine it's because it feels safer, in the sense of, you know, ketamine's being used for treating sort of treatment-resistant depression, or, you know, well, this is prescribed by a doctor, so it must be fine. So I think it has the sort of the mask of safety. Ketamine's also become incredibly cheap. And it's accessible because kids can go online and they're sort of getting access to these drugs in different ways. So it's a lot via social media or the dark web. So, you know, I mean, it's sad, but a lot of kids, because they can buy in bulk from the dark web and they have some sort of sense that it's safer or not cut or whatever it might be, then they're sort of able to become mini dealers and are spreading it around to their friends. And so I think these type of drugs are the ones that I've really seen a rise in. And I think also because, you know, we're dealing with a post-pandemic lockdown generation. So there is that feeling of social anxiety and they're depressants. So they help to sort of numb those sort of hyper-aroused feelings.
Yeah, and I think, you know, it's interesting with ketamine because it's all over the papers. And I think, you know, when I'm speaking with parents and families, I think there's always this question that they ask is, you know, why? And I know that's a massive topic to approach in terms of addiction. And, you know, when a parent asks, why is my child doing this? What would your response to that be? You know, if they're saying, why are they addicted to substances? I don't understand. Like, they've been given so much, or, you know, where's my part in it? What would you say to that?
I mean, I think if the parents are asking, where's my part in it, then they're already asking the right questions because they understand that it's not something that just belongs to that young person who's using substances, and it's some sort of, there's a relational aspect to it. And I think, just on the most basic level, experimentation is really normal in adolescence. So, you know, kids are going to try things out, and, you know, their prefrontal cortex isn't properly developed, so their impulse control isn't great. But yet they're sort of, at the same time, really drawn to stimulation, excitement, and dopamine. So I think it's already a sort of perfect storm in adolescence for addictive tendencies to set in. But then I think what tips people over the edge is, I mean, a lot of the research looks at attachment styles and addiction as an attachment disorder, and the idea that, you know, so what that means is, what we hope is that people can regulate themselves via good experiences of relationships. So having been sort of cared for and contained and held and attended to in a non-judgmental way, then they internalize that and learn how to regulate themselves. Whereas I think, again, going back to COVID and lockdown, I think that really disrupted normal developmental stages. A lot of people's, it amplified attachment difficulties that were already there. Yeah. And so what we're seeing a lot is less experimentation, but when kids do experiment, there's a much greater preponderance of addiction, and much greater inpatient treatment, or deaths. Really, the severity of even though the span of drug use has become less, fewer kids are using, the rate at which those kids are using has been amplified.
Yeah. So when I speak to parents, often they are concerned about their young person. Usually that's the reason that they're contacting us. And I think parents often see a lot online, and they get into these questions of like, is my child an addict, or is my child using substances, or what are the signs that someone is struggling or using substances?
I mean, I think it goes back to what we were saying about experimentation versus substance misuse or addiction. So I guess the obvious thing is that teenagers are going through a transition from being children to being adults, and they can feel really disorientated, and their mood is unstable, and biologically, psychologically, socially, everything's in flux, and they can feel very dislocated. So some level of change in behavior or mood swing is normal, but I think what you're looking for are patterns of changes. So not the occasional off day or the occasional slam door, but more, has my child, is it now the norm that my child is withdrawn, or doesn't feel quite honest, or doesn't come to me, is secretive, physical signs, like do they often have bloodshot eyes, are there sort of smells on their clothes, weed or chemically smells, and also have they, for example, dropped activities that they used to really love, or has their friendship group sort of changed quite abruptly? So I think it's those patterns of behaviours that you're looking for, rather than the fallout with the friend, or the one-off day when they wish they'd never been bored and they slammed the door.
And so we talked a bit about coaching before, and coaching can be behavioural coaching, recovery coaching can be such an amazing and effective tool in working with young people who are struggling with substance misuse. How does it work?
I think it means a lot of different things to different people. And so with my colleague, who's a psychiatrist, Dr. Daniel Masood, we've set up a company called Miracourt. And the way that we operate is we're case managing, but we're case managing as clinicians. So as a psychiatrist and a psychotherapist, we've got the whole biopsychosocial piece covered. And then the people who are doing the coaching are clinicians who are sort of excited about the prospect of being able to use their training and their knowledge of how to navigate relationships in an effective way. But where there's a lot more possibility, they're not limited by what you can do with sort of a huge rotation of clients in a very prescriptive care setting. I can only draw on my own experience and what worked, and also my training. So there's an assessment, so identifying what the problems are, and the assessment generally looks at what are the predisposing, precipitating, perpetuating, protective factors. So what that basically means is you're looking at why that person is using, what's maintaining that use in the context that they're in, and what's already in place that actually limits it, or that they like, or that acts as a sort of bulwark against using. And once we kind of know, okay, this is the person, then there's an assessment period where the coach is sort of building that relationship, because ultimately it is about being able to trust someone and to allow them to support you. And then when that relationship, as they're building that relationship, they're assessing what are this person's defenses, when is it that they feel most open, and what are the sort of patterns in the way that we're relating and what's happening at that time. And then slowly but surely you're creating a sense of autonomy in that person. So maybe at first they need to feel very held, or just almost let you take control a little bit and just sort of relax and take the weight off. But then you sort of pass the baton back, and you're trying to, what teenagers and young adults need is that feeling of autonomy and some sort of control over their own life. And so things that can feel really frustrating in working with teenagers, like, I want to have my cake and eat it. I want all of the freedom and none of the responsibility. If something goes wrong, it's probably your fault.
Yeah.
But that can be worked with in a really healthy way. So, for example, that person wants the sense of autonomy, but they also want to feel supported, and like someone is interested in their values and is helping them to think about what it is that gives me meaning and purpose, and what is it that I enjoy, and what is it that I feel confident in. And rather than sort of trying to map an identity onto me or a plan onto me, they're trying to help me to know what's the version of myself that I want to be, and how can they support me to get there.
Yeah, and I love that. I think, it's and I think that's why coaching is so effective with young people, and once they soften into it, or they get into it, that's when you can really start to work with them. And I suppose they're quite moldable at that younger age. I suppose, what I often see is that to get to that place, sometimes there's a bit of kickback. Yeah. And, there needs to be a certain level of willingness. Yeah. However, sometimes you can work with someone to help them find that willingness. So, when there is a teenager or a young adult who perhaps is, using substances, they're feeling really low in their mood, they've kind of lost hope, but they're not necessarily jumping at an opportunity to seek help, whether that's through psychotherapy, coaching, inpatient treatment, whatever it may be. Can you use coaching in that way? And how does that work? And how could, you engage a coach to support a person to kind of take that next step?
I mean, originally when you were sort of saying that, I was thinking about a client that I met with for the first time a few days ago. And so I met him for an initial sort of session on Zoom, a little courtesy call. And he sort of was ostentatiously just eating crisps and looked really bored with everything that I had to say. It's like, look, I don't really want to be here. My parents think I need to. I'm fine. I don't really see how you're going to help me. I've had therapy before. It was awful. And so I was like, okay, well, tell me about the therapy you had before. And he was saying it was, I won't name and shame, but it was this type of therapy. Yeah. I was like, well, I work really differently. And then at some point, he just turned around and was like, oh, wow, I didn't realize I was sitting opposite the world's best therapist. And at that point, I was like, you know what? Like, I just cracked up because he was right. But I think it's that level of authenticity. I was able to say, you know what? I probably was a bit anxious because you were really resistant, and I probably did want you to engage, and I was trying to reassure you and to do a bit of a sales pitch. So, hands up, you got me. Like, it's true. Yeah. And I think what that sort of demonstrates is that I'm someone who is able to think about themselves, think about their own motives, acknowledge, when they are sort of overselling themselves a little bit. And also I'm able to identify the relationship that's already there as well. So from the very beginning, there's a relationship between us. Your way of presenting makes me feel a certain way, which makes me reply to you in kind. So I think just that openness of sort of being able to model what it is that you want that young person to do. You want them to be able to reflect and to acknowledge where things are going wrong and take them from that pre-contemplative, everything's fine, there's nothing wrong with me, to, well, maybe I can start thinking about it a little bit.
And that's, I think, is a real trick and skill to be able to do. And, I think I've been so fortunate and, lucky to watch so many young people when they find the right fit to have that sort of, partnership, I suppose, that they build with the clinician or the coach that they're working with. What skills do you think, or traits in that person needs? What are those skills that, a really good coach will have? Or, is it more than that? Is it more about, matching the right person and the right coach?
I think when it comes to coaching, and particularly more immersive jobs, the personality of the person is so important, and getting the right fit, because, if I'm seeing someone in my psychotherapy practice for 50 minutes a week, I'm in therapist mode and I'm engaging in a certain way, which would be really weird if I was acting like that 24 hours a day, 7 days a week. Yeah. So you want someone who you know that person will engage with and will enjoy as a person rather than just a professional. But also there is the professional element to it. So you're looking for, if this person is struggling with meaning and purpose and wants to re-engage in occupations or whatever it might be, then I might be thinking from our coaching roster about a mental health occupational therapist. If it's a situation where that person has lots of defenses and lots of resistances to building a relationship, we might be thinking about a counselling psychologist, someone whose job is just to work with defenses and to know how to hold on to the relationship and build it despite those defenses. So I think there's the professional element, but what we're always instilling in our coaches is hold the professional aspect in the back of your mind. You know, your experience, that's all metabolized. You sort of embody that. But really it's just relating as a person, as another human being who cares about and wants to help somebody else. Yeah. But also maybe just acknowledging as well that you're getting something out of the relationship, that it's not sort of one-way traffic and the power imbalance isn't completely tipped in the coach's favour, but actually you get something out of being with them.
So I suppose one of the biggest questions that parents, teens, young adults always have is, what is the difference between coaching and therapy?
I think they're complementary rather than overlapping. So for example, on a basic level, I suppose with therapy, you're trying to be non-directive. So you don't want to stop telling the person what to do. You're not judging what they're saying, but you're trying to understand why. And you're trying to help them to build their awareness or to sort of understand their own motivations a little bit more, or what's keeping them stuck. And it's that understanding that you're trying to build up. But then what the coach is trying to do is to put that understanding into action. So to say, okay, with this new awareness that you're building about where things aren't going quite right, or where you're sort of really talented, or where you do have like huge resilience, now what do we do with that? What's the life that you want to build? And so it's that bridge between awareness and action, I think, that coaches provide. But certainly with our coaches, we think it's really important that they have that clinical training, because they're working as part of a broader clinical MDT where everyone knows their role and everybody understands a similar language and how to work with other people. And so the fact that the coaches we're working with know what the psychotherapist is doing and what the psychiatrist is doing, or whoever else might be on the team, then it means that they kind of stay in their lane. And the young person isn't getting loads of conflicting advice, and it's not like, well, you know, I did some trauma work with my coach, and the therapist's like, what is going on? Yeah. So it's a well-integrated system where it's sort of organized. We're working in an organized way rather than a disorganized, sort of mutually contradictory way, which can often recreate family dynamics where, you know, the right hand doesn't quite know what the left hand's doing, and the kid sort of falls between the cracks or feels torn between two opposing points of view. And
I think that's, you know, because often I think, you know, many young people feel like everything's very messy and I think disorganized. I think it's rare that someone, you know, approaches this sort of help in a place of feeling manageable. Yeah. And, you know, I think it's so important to have a manageable team around them, and that structure and, you know, the boundaries and understanding of what someone's role is and in their life and how to support them. And, you know, it makes me think about, you know, how messy things can feel for young people and how messy things can get and unmanageable. And I suppose, you know, often I think parents who I speak to feel like they are the only ones. You know, they look around and they think no one else's children are doing this, or no one else's child is in this situation. What would you say to a parent who's thinking that or feeling that about their young person?
I mean, I would start by saying it's not true.
Yeah.
And I think the reason why there can be that misconception is precisely because of that feeling of guilt and shame that parents have. I'm the only one, no one else is doing this. And so when you feel guilty and ashamed, you don't necessarily broadcast what's happening in your home. And so I think that can be why parents experience a problem as being unique to them, whereas actually it's probably much more, you know, in various different ways. You know, as you say, being a teenager is difficult, and you're going through lots of transitions, and the family has to transition along with you. And you're sort of on that roller coaster ride with the young person. So in whatever way, like any family that has teenage children is going through some sort of moment of having the status quo rocked, or they're in some sort of flux. And I think if they're not, something's not going right developmentally with the young person. If they're sort of really compliant and always just sort of doing the right thing, then I think that's more of a problem. However, when it comes to a point where there is substance use in place, or in play, and I think it's about, that ability to introspect and to think, okay, what's going on? And I know that the research shows that when it comes to working with young people, having therapy for the young person is great, but there's a cascade effect. Like young person and parent is better, but actually couples therapy for the parents is the best, because it cascades down, and parents are the ones who have authority. And what young people are looking for, which I guess is a theme that's coming up more and more as we're talking, is that feeling of being contained or held, but not constrained. So, they want, rather than the authoritarian parent who's basically just saying, well, do this because I said so. Or at the other extreme, the permissive parent who's like, no, I trust you, just do whatever you want. You want an authoritative style of parenting. So one where you have boundaries, but you understand that young person might have a response to what you're saying. And you're interested in how they feel about it, and you're open to honest communication and honest feedback and working things through, and potentially even adapting a little bit, with the new knowledge that you're getting. And so I think keeping the lines of communication open is amazing for remediating and mitigating the sort of problems that are presenting. It's just about, going back to what I was saying earlier, not judging what's happening, but exploring the why, and giving that young person a feeling of autonomy and agency, where you're trying to understand what they want and to support them to achieve their ambitions rather than telling them what they need.
Yeah, and I think that's such a valuable insight for parents, I think, to hear that message that actually getting support for the whole family and the system is where real change can happen. And I often think about it in terms of recovery for a family or a young person, is that we go through seasons, and those seasons affect everyone. Absolutely. And it's a constant, renegotiation of relationships and understanding. So say, there is a parent who's watching this, whose child is perhaps struggling with the ketamine use, or, they feel at their wit's end, or, really worried. What would your advice be if we could break it down to a bite-sized kind of simple steps for a parent?
Okay. I mean, I think step one, if you feel like there's an issue within the family that is beyond your control or beyond your scope to be able to contain it, then if your job is to contain the young person, you need someone to support and hold you. So just seeking advice. So going to your GP, going to a therapist, going to professionals who can really support you to navigate the process would be step one. And then what you're hoping with that support is that the professionals who are in place will, on a very practical level, know what to do, but also on more of a relational level, be able to help you to think about the dynamics that are in play and whether they're serving the family as a whole, and how you can reach that point where you're able to have sort of conversations that feel warm and non-judgmental, and where everyone can be open. And because it's tough, teenagers can really get under your skin, particularly because you have skin in the game as a parent. What they do affects you in a way that I think there's always the illusion that, therapists are somehow trained to relate in a different way. It is true, but it's also, with their own kids, it doesn't work in that way, because there are the feelings of guilt and shame, whereas we have a bit of critical distance as therapists to think, we see you in a controlled way for 50 minutes a week, so what the difficulties that you're going through, we feel a lot of empathy towards your situation, but it doesn't have huge implications for our lives outside of the therapy room. And I think that's the key difference, is understanding that you're not doing anything wrong. It's just dynamics can come into place when you're in that period of transition, where you feel out of control and people just react, and there's a sort of power play and everyone's trying to get control. and just having someone to help you to sort of unpick those dynamics and get back to something that feels a little bit more stable, a little bit more cooperative and collegial within the family is really useful.
And for parents who maybe have a feeling or a sense that they might be part of the ongoing dynamic, how do parents know if they're contributing to the problem?
I mean, I think it comes from understanding that everyone within a family impacts each other. So it's not just a problem that's located in one person, it belongs to the whole family. So, if you can, step one is just thinking about what's my part in it. And I think that's something that everybody has to do. So it's not unique to the parent and they haven't caused the problem. But there is a dynamic in place where something potentially really risky is happening. So it's about saying, okay, well, how do I think about what my part in it is? And again, it's completely natural, but it does go back to, that idea of, where do I sit on that spectrum between really permissive parenting and authoritarian parenting? To what extent does my child feel like they can come to me and I'll listen to them in a non-judgmental way and they can be open with me? To what extent do I know what they're doing? Because again, it goes back to that feeling of children wanting autonomy, but also wanting to feel safe. So the research shows that actually it is really helpful if just knowing where your child is, or if you're friends with your child's parents, it helps to give, almost knowing where your child is like a proxy for care. Yeah. It helps that young person feel like my parents trust me, but they also are looking after me and they care about where I am.
So you talk about the more authoritarian parent. Could you describe that to me, or perhaps, one that you've worked with and how that's kind of played out in a family dynamic?
Yeah, I mean, I work with it a lot, and I think it works often with children because they're completely dependent on you. Yeah. So just saying, this is what you need to do, and not really explaining why kind of is enough, often. But I think where that type of parenting can come unstuck is in adolescence, where the young person is naturally and developmentally predisposed to sort of push back, and they're trying to establish who they are and what is it that I value and who's the person that I want to be. And they're going through that process of separation, individuation, and identity formation, where they're trying to become an adult. Yeah. And they're trying on loads of different hats. And so that authoritarian stance just doesn't work because it antagonizes the natural developmental process that young people are going through. When you say, this is what you've got to do, because I said so, this is the person that you need to be, there's no space for thinking about who's the person that I want to be. And so you have this hard wall that teenagers bash up against. Yeah. And you end up with the relationship being broken in some sort of way.
So the broken relationship is a sign of that. And for, I suppose, the other end of the spectrum, do you call it permissive parenting? Tell me about a permissive parent that you've worked with. What are the signs of a permissive parent, and how does that relationship or style of parenting affect the child? What happens?
I think then it goes back to what teenagers need developmentally, which is a level of autonomy, but also to feel safe. What you're taking about, in the first instance, we were taking away the autonomy, whereas in this instance, we're taking away the safety. Yeah. So there's the idea of, I'm young, like everything's new to me. I'm being positioned in society in a completely different way. My body's completely changing. My mind and my capacity to sort of think and to feel are developing in very strange ways that are alien to me because I've never experienced them before. And where are my parents? They want someone to sort of care and be there and to regulate them emotionally and to sort of offer some sort of safety net where if there's some sort of peer pressure to do something, it's like, oh, my parents are in my mind and they would care if I do this and they would find out. And, just that safety net of having a parent who, while they're not completely controlling everything that you do, they're aware of what you're doing.
Yeah, and I like that because I think, it's great to hear, I suppose, the theory behind it, and I think that's really helpful. And I think, you know, then if we looked at what it might look like in play, you know, for example, would that be like a parent who is quite absent emotionally and physically, or would it be a parent who perhaps, you know, lets their child do whatever they like in terms of their plans? You know, how does it look? If, you know, if we looked into someone's family home, or if we looked at someone's life, what would be happening in that life where someone is in that kind of, I suppose, parenting style?
Yeah. I mean, I think it might be, you know, the parent who is the best friend, or who just gives their kid an undue amount of trust. You know, there's this expectation that, you know, my kid's great, you know, they make excuses. Well, you know, it's part of, you know, growing up, and they're going to experiment, and boys will be boys, and all of that sort of thing. The parent who's essentially burying their head in the sand in some sort of way, who doesn't care. But then I guess on the point of parenting, I think that I'm speaking in a really amplified way about this caricature of a parent. Most parents are doing a great job, and they're really trying their best. And there are so many factors in play in a teenager's life. So, for example, what they're doing developmentally is moving away from that dependency on the parent to dependency on peer groups, and their peers become incredibly important to them, and what, you know, their friends think about them. So there are sort of many factors that are way beyond the parent, particularly when we're dealing with adolescents and young adults. So I think it's about not getting into a culture of parent blaming and thinking, what are they doing wrong, but more just thinking, what is their part, and how can they help? Because most parents want to help.
Thank you so much, Topes, for
You're welcome.
joining me today. It was so valuable to hear both your, you know, experience and all of your work experience as well. I think it's so valuable. I think the thing that I certainly will take away from today, and I think that I really heard, was the value of understanding the system and looking at everyone's roles and relationships and plays in those systems. So I think it'll be really helpful for people who watch this, if they identify as the parent or the teenager who's struggling, or perhaps a family member of, you know, knowing a family who's struggling. I think hopefully this has given them some answers of, you know, what can I do now, and how can we get better?
And I think just on that point, I think that's exactly it. It's also recognising that young people are involved in multiple systems, and it gets very complicated. So as you say, the systemic thinking is really important.
Yeah.